How does a doctor confirm a food allergy diagnosis? There is no one test that can accurately confirm if a person has food allergies because symptoms are unique for each person. Allergists must rely on a combination of tests to confirm if you have a food allergy. Let's walk through each part of the test so that we can understand the full picture. First is the skin prick test. This is the most common test used at an allergist's office. A tiny amount of food allergen is put on a sterile probe. It pricks the skin on the arm or the back. Washable marker indicates the placement, and there are 2 additional drops with each test. A histamine response ensures that the skin properly reacts, and saline solution, which does not cause a bump. These are the positive and negative controls in the test. After 15 to 20 minutes, the skin is examined for redness, which is called flare, or swelling, which is called a wheal. False positives can occur with sensitive skin, for example, which is why this test is only partially a tool for allergist diagnosis. It's not only the test that confirms the diagnosis, but it's just a piece of the puzzle. Be sure to ask for a copy of the results upon leaving the doctor's office, or at least snap a picture. Also, you cannot take antihistamines up to 7 days before the test because they interfere with the results. The next type of test that is done to, again, get a certain picture of the diagnosis, but is not comprehensive on its own, is blood work. Doctors can order the patient to have blood work taken at a medical clinician's office. In a lab setting, the blood is mixed with food allergens to measure the amount of IgE antibodies in the specific foods. These results can take a few days or even a few weeks. They're reported as numbers, which your doctor can help you interpret. So the numeric results can range from 0.10 to 100 and higher. And it's broken into different metrics that indicate a class 1 through a class 6 level of IgE levels. But this doesn't necessarily mean the severity. In fact, high levels of IgE don't always correlate with high levels of severity of a reaction. It's a little bit counterintuitive. Instead, the numbers are indicating the likelihood of a symptomatic reaction or the sensitization to the allergen. The blood testing cannot determine the diagnosis on its own, but there are components of specific food allergens that can be tested where they isolate some of the proteins. Component testing can give a little bit clearer of a picture on severity, but research is still underway. There are so many other factors that are paired with these tests. Doctors are looking at family history, previous reactions, physical examination overall. How sensitive is the skin? How sensitive is a person's reaction to stress, food challenges? All of these factors are paired together to determine this overall diagnosis. Let's talk about the third piece of this puzzle, which are the oral food challenges. So in this case, it is the last piece because oftentimes the blood work and the skin prick test results can give enough guidance as to what foods a person should avoid. However, sometimes these results still do not provide clarity until you test whether or not an actual reaction will occur. This is an optional step for families, and you can consult with the doctor whether it's an appropriate next step or not. For oral food challenges, expect that these take a few hours at the doctor's office, as the patient starts with a very small amount and gradually works up to a full serving under medical supervision, provided that there are no reactions. Food challenges are determined only after a board-certified allergist is carefully reviewing the full picture of the skin and the blood work tests and understanding if this is a third step to help complete the puzzle. Now, keep in mind that with these false positives, there are up to 60% of blood tests and skin prick tests that are false positives. That's why each test is a clue, but the full story is not straightforward. It's always best to work with your doctor and recognize that shared goal is to untangle this complicated web, or the maze, as I showed you earlier in the visual, to develop an allergy plan that gives you back control and helps create a life that is more comfortable and safe.